Assalamualaikum and hi, let's learn about echolalia. Okay, let's get to know the term of echolalia. So what is the definition of echolalia? So echolalia is the repetition or echoing of words or sounds that the children hear from someone else. So next slide is about the introduction of echolalia. Have you heard toddlers or children mimic noises or words when they hear others speak? So this repetition or imitation of sounds, phrases or words, this is called as echolalia. This term comes from Greek words echo and lalia, which means to repeat speech. And it is an attempt from children to communicate, to learn language and practice that language. And it is commonly seen in children older than 3 years. But it may become a problem if it is continuous in children older than 3 years. Normally, aged around 2 to 3 years old, children tend to do echolalia. But if the children get older than 3, still do echolalia, so this may relate it to autism, DCD, or etc. So there are reasons of children why they use echolalia for a communicative purpose. One of the reasons is to ask for things, and it is to start an interaction and also to show something. Okay, next we can know the symptom or occurrence and types of echolalia. So the symptom of echolalia, this echolalia shown by children by repeating phrases, words or noises that they hear or when they hear others say. So it is main symptom. So the occurrence of echolalia, the echolalia can be a sign of autism or developmental disability in children, or may occur as neurological problems in adults, which is stroke, psychiatric disorders such as Tourette syndrome. So there are two types of echolalia, which are immediate echolalia and delayed echolalia. So the immediate echolalia happen when the toddlers repeat something almost right away, and it could happen slight delay while talking to someone. Okay. For the second type of echolalia, which is delayed echolalia. So it is involve delayed repetition of words. Delayed repetition of words for hours or days after hearing them. And it is usually seen in people with autism spectrum disorders. So does echolalia can be treated? So this slide shows the treatment of echolalia. So the first thing is speech therapy. So speech therapies was conducted by therapists or speech language pathologists. Okay, so they need some professionals to create effective way to treat autism related echolalia. And therapists observe the children and try to understand why they keep repeating the same words. So they also listen to these children and respond in a way they could understand. And the speech language pathologists use behavioral technique and this speech therapy, verbal and visual cues, or other creative learning methods, self-monitoring and positive reinforcement to treat this echolalia. And the second one is through medication. So, such as antidepressants, selective serotonin reuptake inhibitors, SSR. This medication can be used as a treatment for echolalia if it is caused by stress, anxiety, psychiatric disorders. While for the echolalia that is triggered by neurological condition, doctors may give them specific medications for these disorders. Alright, that's all for today. Thank you.